Providing comfort, creating a peaceful end of life. The goal of this module is to build upon your existing hospice care skills and knowledge to feel more comfortable and empowered on the Comfort Care unit and on your own units, and to know where to go for help when and if you need it. The objectives of this module include orientation to the Comfort Care unit, overview of common medications used at the end of life, communicating with veterans and their families at end of life, facilitating a comfortable end of life, and demonstrating knowledge of principles of end-of-life care. We're going to start with a general overview of hospice care and a quick orientation to the Comfort Care unit and situations you might encounter on that unit. What is hospice care? The primary objective of hospice and palliative care is to increase the quality of life for veterans and their families who are facing an advancing life-limiting illness. Hospice care means achieving the best quality of life for patients and their families when a cure is not possible, providing for a peaceful death as defined by the patient and family, and aiming to reduce pain, anxiety, fear, and agitation. Here are some of the changes you might see in a veteran who is nearing death. Veterans who are nearing death often spend more time sleeping and may be difficult to rouse. As circulation decreases, it is normal for the veteran's skin to appear mottled and to feel cool and possibly clammy. It's also normal for veterans in this stage to experience erratic, irregular breathing patterns and cardiac dysrhythmias. Accumulating bronchial secretions can result in loud, rattling sounds with each respiration. Veterans may often stop eating and drinking and will experience subsequent weight loss and dehydration. GI symptoms can include nausea and vomiting, or the veterans might experience constipation, diarrhea, or loss of bowel control. Changes in level of consciousness may range from unresponsiveness to delirium, confusion, and agitation. Prior to death, some veterans experience a sudden, temporary burst of energy and may seem more alert. All of these changes are normal components of the natural act of dying. Medications and supportive care can help to alleviate some of the discomfort associated with them, but the goal of end-of-life care is not to stop these processes, but to support the veteran. A more detailed summary of end-of-life changes can be found on the laminated sheets on each unit. Roles on the Comfort Care unit. The goal of the Comfort Care nursing staff is to collaborate with hospice care teams to create a comfortable end of life for our veterans. Hospice agencies create and revise the veteran's plan of care. They reevaluate the veteran's hospice status every 2 weeks or as needed, and they provide support and guidance to the Soldiers Home nursing staff. The nursing staff executes the veteran's plan of care. They act as a liaison between the veteran and the hospice facility. They facilitate comfort and safety for the veteran, and they report any significant changes in the veteran's status to the hospice agency. Together, the hospice agencies and the nursing staff at Soldiers Home Holyoke collaborate to provide the highest quality of care. They provide support and guidance to the veterans and the families on the unit, and they facilitate a comfortable end of life for veterans. Each veteran's plan of care is managed by one of 3 different area hospices. If you need information that you can't find in the veteran's chart, feel unsure about a medication order, or have concerns about how to interpret changes in the veteran, do not hesitate to call the veteran's hospice provider. General contact information for each hospice agency is located at the nurses' station on the Comfort Care unit. Additionally, highlights from this module are also printed on a laminated sheet and can be found on the Comfort Care unit and on every unit at Soldiers Home Holyoke,